Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and today we're going to talk about all the things you need to know about dog dentistry. Dental disease in your dog has a significant impact on the overall systemic health of the dog. So what few people stop to think about is that the mouth is part of the gastrointestinal tract, and it is full of bacteria. And so dental disease that is left unchecked in the dog's mouth can actually seed infection, all of those bacteria, into the bloodstream. And then the bloodstream carries that infection or that bacteria to other organs in the body. The heart, the valves of the heart, and the kidney are the two organs that get showered most classically with bacteria from the mouth. So when you make an effort in taking care of your dog's oral health, you are by extension improving the health and well-being of the heart and the kidneys as well. Clinical signs of dental disease in dogs are numerous. Most owners will complain that their dog's breath smells bad, and that is probably the number one thing that an owner would notice at home. Infrequently are owners actually opening their dog's mouth and or picking up the lips to actually look at the teeth themselves. But here in the office, we do that all the time. And so besides bad breath, what I often notice is that dogs' teeth will be heavily coated in what we call dental tartar or calculus. It's the same thing that would happen to our teeth if we didn't brush our teeth. So in the dog's world, they're not brushing and they're not flossing, and so all the food that they're ingesting day in and day out just starts to build up on the teeth. The teeth themselves become stained or discolored, and more importantly develop what we call a biofilm of tartar over the teeth, which then as time goes by gets thicker and thicker. And in addition to that, we also see reluctance to eat or inability to eat. You may notice that your dog goes to the bowl, shows interest in eating, and maybe only takes out a few bites, and or when he or she takes the bites, they chew and they are maybe dropping food or dropping the kibble while they're chewing. Oftentimes you'll see dogs cock their head to one side or the other. Those would probably be the most common signs of dental disease I see. Bacterial infections that occur along the gum line, what we would classically call gingivitis. And gingivitis is infection of the gums, and it's being caused by bacteria in the mouth that's not been addressed or taken care of. I also can see growths in the mouth, either on the gingiva itself and sometimes in the mouth, under the tongue or along the lips. And of course, classically, fractures. I very commonly see tooth fractures in dogs, and in most of those cases, it's a preventable problem. Well, we recommend having your dog examined annually, not just because of dental health, but just because that's best practice in keeping your dog healthy. So in this hospital, we're looking at teeth every single year when that pet comes in for their annual exam. And ideally, that pet's dental care would be taken care of every year as well. So not just an exam, but once your dog reaches the point where there is evidence of dental disease going on, we will recommend that your dog start having annual dental cleanings. And the importance of an annual dental cleaning is the same as it is for you and I when we go to the dentist. It's to develop a pattern of care that's preventative rather than managing problems or fires once they start. So a dental cleaning in veterinary medicine mirrors what we do in human medicine dentistry very closely, with the exception of general anesthesia. Unfortunately, my patients don't have the patience or the self-control to not eat the dental equipment while we're doing a dental cleaning. So for the safety of that animal and to allow us to do a very thorough oral exam and dental cleaning, we're going to have to put your dog under anesthesia. The dental cleaning itself for most pets, and certainly for those undergoing a dental care for preventative needs, takes maybe about 30 to 45 minutes at most. Once the patient is under anesthesia, we're going to take a full set of dental radiographs so that we have a chance to actually evaluate the health of the tooth above the gum line, the part of the tooth that you would not be able to see. That's the root of the tooth. And in doing so, we're oftentimes able to pick up abscesses, we pick up sometimes cysts or growths in the mouth. And so after dental x-rays are taken, we're gonna clean those teeth. We're gonna use a high-speed scale to take all of that tartar and calculus off of the teeth. And then we're gonna finish with a polish to make those pearly whites stay nice and pearly white. So thanks for spending some time with me today. Again, I'm Dr. Kelly Harper, founder of Tuscan Ridge Animal Hospital, and I hope you found this little video helpful on everything you needed to know about dental care in your dog. If you have any questions, feel free to reach out to us.